been a male for too long.
But you're lucky to be married because then when you had to leave your job, you still had insurance.
Later, our husband made too much money, so we couldn't get any help with our medication. There's a lot of people that actually do divorce. Yeah, because 75% of people living with MS have insurance, but they're underinsured, so it's not meeting the needs. Especially MS is a really expensive disease. It's over $50,000 a year to live with MS.
They treat it like a choice rather than an illness.
And then when you also take your time out of work, how are you going to pay the bills? Which probably goes more into the depression as well.
And I really had to be so proactive in going and getting all this stuff. It's really hard to get prep to pursue a therapist or make decisions about outpatient, inpatient, work, all that kind of stuff. You really need an advocate.
What was everybody most surprised about?
I guess the lack of coverage. I mean, not being like I said, abandoned when you have these conditions getting worse and nowhere to go.
And they're running around, trying to get price quotes for the labs, for example. You go to one lab and the lab saying next to get a fair, a quote that you can be able to afford and pay.
The little caveat at the end that said what they ended up quoting us was for people who have no insurance.
Exactly.
And because we have insurance, and our insurance would, they have, as part of their agreement with the insurance provider, they knock the price down, which I think is unconscionable anyway.
It's complex because my wife and I, obviously, we want to pay the best price, but that's not our only consideration. Think about this is our baby,
yeah.
And so in many cases, I have to admit we haven't gone with the less expensive one because we feel more comfortable with this hospital, or this hospital is closer, or certain things like that.
It's not just rational decisions.
Some of that, yeah.
People can show you the numbers, but there's also the emotional side.
And the other thing, which is a big assumption in that scenario, is that the two spouses had time to make the calls.
As a service provider, it's one thing that I noticed with a lot of my clients is that you don't know the language, you don't know the system, you don't know the policies. You have nobody to help you basically.
Yeah.
So you're left. I mean, I know some women who just the whole pregnancy did not even go see a doctor, and just waited until they were in labor to go to County Hospital basically.
It used to be a low-income problem. Now it's a more low and middle income issue.
And actually, she's only got about 4 or 5 years of earning power,
right.
And it's greatly diminished. So she's going to be. I don't even think she'll have really enough. What does she have left over? Because this constant drawdown on her earnings are just going to leave her in a very bad situation. I mean, and then you rely on the income from Social Security, and that's really rough. I mean, it's bad news then. And she'll have the Medicare, but she's got precious little else after that.
I'm employed. I have a Blue Cross Blue Shield PPO, and I'm still paying $2,400 a year in out-of-pocket expenses. $200 a month in copays for managing diabetes and all the related illnesses that were on their card. I have every one of them, except for the knee surgery.
Oh, wow.
And I'm a lucky woman.
We're charged, and it's turned out to be 4 and 5 times as much. So, I mean, it's shocking, and it's true, because the hospital is kind of making its budget, and it's saying, okay, I've got 250 beds that are going to Aetna, and 250 beds that are Blue Cross Blue Shield, and 300 beds have to give to Medicaid and Medicare, and I've got, these other 100 beds, and I need to make up all of this extra cost from these discounts, because Aetna gets a discount, and Blue Cross Blue Shield gets a discount, and Medicaid and Medicare, as we are discussing, is very low reimbursement rates. So they're trying to make up their costs with the uninsured and writing out billions of bad debt and charity care.
Some of them have very, very high deductibles, like $5,000 deductible for the hospital. They break an arm, it's going to cost them $5,000.
The European healthcare system in many of the countries have limited health care for years. They haven't explained all the options, so they have virtually limited what kind of care is available to their people. They don't go into the catastrophic, the heart transplants, the extremely expensive cancer treatments.
We don't expect to have to wait.
or if there's a line, we don't expect it to take up an hour of our time.
Yeah, I was saying you just go to a pharmacist, tell him what you want and need, and he gives it to you.
So you can get any drugs you want.
Yeah.
Well, that's pretty cool.
We had talked about having one of the cards that you would get all in another language. Because especially in the Chicago metro area, you call it cultural competence. A lot of hospitals are just not prepared for that.